and thank you very much for everybody for being so hospitable to the WHO team. I'm going to give a very brief overview of what the resolution consists of, what WHO has been asked to do in that resolution, and more importantly, what countries have committed to do in the resolution. But first of all, let's just have a recap of what the global situation of palliative care is. And I think the Minister was being very humble when he was talking about how Ireland has so much more work to do, because he then described a vision of palliative care which in many places of the world would be a palliative care utopia. The reality that we are facing is that most people who need palliative care have no chance of accessing it. Most people who need pain relief do not get it. We have 40 million people a year who need palliative care, and even if we just take those at the end of life, in the last year of life, less than 14% currently receive it. So this is a fairly huge global challenge that we're dealing with here. And of course, it's only going to grow. We know that palliative care is needed for a wide range of diseases, not just cancer, not just HIV, but an increasing range of conditions and an increasing range of multi-morbidities. So it's not just a huge global gap. There are inequities in this issue everywhere we look at it. If we look at the access to pain relief, if we look at the fact that 98% of children that need palliative care are living in low and middle income countries. Even within countries, if we're looking at inequities in access between disease groups, we know in some countries patients with cancer diagnoses get much earlier access to palliative care, for example, than some with other diseases. Vulnerable groups are missing out. So what are we talking about with this resolution? And I'm not going to do it justice by trying to describe it in one slide, but this was a landmark because this was the first time that all ministers of 194 member states joined together and made a unanimous commitment to palliative care. And what are the key things that they recognised in this resolution? Firstly, they recognised that it's an ethical responsibility of health systems and of health professionals. It's fundamental to improving quality of life. They also recognise in the resolution that it's limited in most of the world. It's poorly integrated into mainstream health systems. There is incredible avoidable suffering because of the inadequate access and inadequate use of controlled medicines for pain relief. And that this is held back by a lack of knowledge and awareness, not just in health professionals, but policymakers and the public. They also recognised, importantly, that cost-effective and efficient models of palliative care exist that are within reach of all income settings. There are numerous policy and legal mandates for improving access to palliative care and medicines. And fundamentally, they recognised that palliative care needs to be available for all people of all ages with all diseases. So what did they ask us to do at WHO? Some of the priority actions that they've requested WHO's support on, and our director will go into much more detail on some of the ways we're taking this forward, could be described in 5 main areas. Firstly, integrating palliative care into the core work of other WHO programs. It's all good and well to have a standalone, siloed program on palliative care, but what is more powerful is to have palliative care as front and centre in our work on health system strengthening, on NCD, in emergencies, and so on. Secondly, developing tools and guidance for member states on the various aspects of palliative care. Supporting member states to improve access to medicines. Building the evidence base for models that work, especially in low and middle income settings. And lastly but not leastly, improving monitoring and tracking progress. How we do that, as you can see from the composition of the panel today, We work from headquarters, our 6 regional offices and country offices in 140 locations. This is a cross-cutting issue, as Dr. Kelly's explained already, that involves not just the departments you see in front of you, but colleagues in HIV, colleagues in emergencies, colleagues in TB, all across the organisation. And we're trying to encourage this responsibility that palliative care is everybody's responsibility, not just the domain of a few. We couldn't do this alone, and we're very grateful to have the support, many of whom are in the room, of a very enthusiastic ad hoc expert advisory group who are helping us deliver on the commitments that WHO is expected to do. We also have a network of WHO collaborating centres on palliative care that have been helping us for many years and continue to do so. And of course, we also work with NGOs and official relations and a number of other partners to help us in our work. But what did the resolution ask countries to do? And this is where it gets important. Fundamentally, the resolution asks countries to develop and strengthen palliative care policies and services that are integrated in all levels of the health system, but especially primary health care, home-based care, community care. And inherent in that is that there is the funding and human resourcing to enable those plans to be put into action. Training is another major aspect that the resolution asks countries to do. And training means that there's a basic level for everybody, that all nurses and doctors and health professionals should have a basic competence in palliative care through their undergraduate training, progressing up to intermediate level training for those that work more frequently with patients facing life-threatening illness, and lastly but not leastly, specialist palliative care services. Thirdly, supporting families and caregivers and volunteers. And this is not something that we can neglect here, because the social support and social protection through patients and their families that are facing life-threatening illness can involve catastrophic costs and consequences, not just for patients, but for their entire families. Improving access to medicines, and there are 3 specific actions that governments are requested to do. Assessing the national need and improving the supply. Reviewing and revising their national legislations to be in line with the UN International Drug Conventions. Updating their national medicines lists to be in line with the new model WHO medicines lists that have been revised recently to include palliative care medicines for adults and for children. In summary, we can see that palliative care is not just an important health issue, it's an avoidable humanitarian crisis. There is no reason that a country of any income level cannot do more to relieve suffering. The resolution recognises that. It recognises that earlier and better integration of palliative care into health systems improves quality of life and saves money for health systems, and that this is especially urgent in settings where access to early detection and adequate curative treatments are a long way off. And that the key fundamental themes of what's required to do that are supportive policies, human resources and access to medicines. So WHO will continue supporting countries to implement these commitments, as well as monitoring progress and implementing and building the evidence of what works. But the important thing to note here is that if leaders are after a single indicator that simultaneously is a measure of a well-functioning health system and a society that values dignity and human rights, then access to palliative care is that indicator. And lastly, but absolutely not leastly, what can you do? The WHO resolution is an incredibly important mandate and source of inspiration, and many of you have been focusing your attentions on this for decades. But the implementation of a resolution happens in countries, and this is where you have such an important role. Civil society, professional groups, advocates are the ones that have such a key role in holding governments to their commitments, reminding them of what they promised to do in these resolutions. We have a report on progress. Is the roof about to fall in? We have a report back to the World Health Assembly next year on progress with the resolution. But I'd also like to encourage you to look forward for other opportunities where palliative care can remain on the agenda in the international settings. The resolution is one of these things, but there are other opportunities such as the UN General Assembly Special Session on Drugs, the UN NCD high-level meetings, as well as large global movements around healthy ageing. So as you focus on how to implement the resolution, also keep an eye to the future and how you can keep infiltrating palliative care into the global agenda. Thank you.